China's Zhejiang, a big industrial province near Shanghai, is battling around 1 million new daily COVID-19 infections. The number of expected to double in the days ahead, and the provincial government is, of course, giving us this update. And despite a record surge of the cases nationwide, China reported no COVID deaths on the mainland for the 5 days. Through, of course, Saturday, the Chinese Center for Disease Control and Prevention has said the citizens and experts have called for more accurate data as infections surged after Beijing made sweeping changes to a zero COVID policy that had put hundreds of millions of people under relentless lockdowns and battered the world's second largest economy. At this point of time, I've been joined by Dr. Anil Arora, who is a health expert, Sanjeev Srivastava, who is foreign policy expert. Dr. Arora, come to you, start with you. How do you see the situation growing out in China? Because there has been a massive crisis. At this point of time, the medical healthcare facilities also seem to be collapsing in China. What do you have to say on that?
Thank you, Riyanka, for having me on your show. You see, this Chinese policies, which have been so much criticized from all across the globe because of their zero tolerance COVID policy, had to be finally undone. Backed by the street protests by most of the Chinese, I think Xi Jinping had no option but to back down and try to undo the lockdowns. So what has resulted is what we are seeing now. So there is a huge population in China which has neither been vaccinated properly with the conventional established vaccines, and they have never been exposed to the natural infection. So since they backed down completely from a zero tolerance policy to open air stance, so this is what you are seeing. If you look at today's data from a city called Zhejiang, they have already reported about 2 million cases per day. Fortunately, at the moment, according to their reports, if we have to believe, problem with China is we cannot believe the data presented to them. It is an opaque society. So if we believe them, most of the infections are mild, they can be easily maintained, and they still have an infrastructure to handle the infection. And luckily, the BF7 variant, which is a sublineage of the Omicron variant, which the world has already gone through, is not as pathogenic, as virulent, as vicious, and as devastating as the Delta wave which had affected most of us. So even though the number is high, at the moment it's their medical facilities are still not crippled. The only problem for us in India, because of that big surge in China, is because if you have a huge population which is exposed to the virus, so virus is likely to multiply at a brisk pace. And we know from the evolutionary biology that the more the virus multiplies, the more it is likely to mutate. So for the timing, that is not a problem, but we have to keep up our guard, because some of the travelers may have already been out of the China during being exposed to the existing virus in the China, and may travel to India by direct and indirect routes.
All right, Mr. Sanjeev Srivastava, I come to you at this point of time. How do you also see China's situation where, they are not releasing the proper data and we don't even know how many deaths are taking place? We just know that millions of cases are being reported. What exactly is China trying to do?
Well, first of all, good morning to you. Good morning to Professor Arora and to all the viewers, those who are watching this show. You know, China is known for this kind of behavior, which is always deceptive. You cannot trust in Chinese data. You cannot trust from the information which is being given by the Chinese Communist Party. So I think it's a very hard, and a very, very tough situation to assess really what's happening on the ground. But given the kind of policies they had adopted, a zero COVID policy, and also a very poor vaccination drive, which is being reported from China, and also the way they have been, attempting to cover up the entire thing with its so-called zero COVID policy, all those, factors has led to this kind of a crisis situation. Obviously, there are also question marks about the efficacy of Chinese vaccines. How fine they are working, I think that's still a very big question mark on Sinopharm and Sinovac vaccine. If you compare that vaccine with the other vaccines, I think the other vaccines, including our own countries, they are doing very fine. But certainly, this mess which China has created, that's their own creation. That's a creation of the Chinese Communist Party, and they were, trying to hide everything from the international community. That they have no COVID, zero COVID, etc., etc. But I think these are the criminal acts which the Chinese government has done. Better they realize the gravity of the situation and release information so that international community can also get active to help people of China. I think WHO or international community can only help the people of China if the Chinese Communist Party led government comes up with a clear data, with a clear, honest assessment and information about what's happening on the ground. But certainly at this point of time, situation is very sad, and it's very unfortunate to see that Chinese people are suffering this much.
All right, Dr. Arora, when it comes to vaccination, as Mr. Srivastava was saying, how do you also see the situation in China, the vaccines that China had given out? Because in one hand, their strict COVID policy was also causing problems, and now once they relieve that situation, the condition in China has gone out of hand completely. What about the vaccination that has taken place?
You see, Riyanka, the vaccination which has been given to the Chinese population in the past, first of all, as Mr. Sanjeev very rightly said, we do not have the correct data. It has always been a very perfidious and opaque society which never gives the true data even to the so-called masters of the world like WHO, and you have to rely on the sketchy data which is available. The Sinovac, which was approved in May 21 by WHO, has been used only in China, and some of the countries which had started using it did show that it is not as potent and efficacious as our own Covaxin and the vaccine from the Bharat Biotech. So because of the inferior quality of the vaccination and the fact that they had severe zero COVID tolerance policy, they have a large population which is virgin and exposed to the virus. So for the time being, they may have to have vaccine which is effective, be it an mRNA vaccine from Pfizer in the US or our own vaccine from the Serum Institute of India. Because of the type of political system they have, I don't think Xi Jinping will ever ask for any vaccination from India. Vaccination is something which is extremely important to decrease the severity of the disease. It may not be able to prevent the infection, but for the time being, I think the priority is to contain the infection. So rather than going on for a zero tolerance policy, they will have to step up their guard and vigil so that the infection does not continue to spread all across the China, which has a huge and humongous population of 1.4 billion. Because the implication lies not only in the Chinese territory. After all, virus is airborne. A large number of the people will be traveling to and fro from China, that being the biggest economy in the world. So it has direct and indirect impact on the surrounding nations, including the neighboring countries like India. So it is a high time that they ask for a good vaccination program, and rather than shifting to no surveillance from zero tolerance policy, rather than taking a total somersault, they have to up their ante and try to contain the infection for the whole community in general, not the Chinese in particular.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.